welcome to the Senior FYI. Hope you guys all had a great week this week. Today, we have Kathy Devine from the Executive Office of Elder Affairs. She is the director of the Prescription Advantage program. And Kathy is going to give us a little background on Prescription Advantage, and hopefully not just for the seniors, for pretty much everyone, but she's going to give us a little background on Prescription Advantage. Welcome, Kathy.
Debbie, thank you so much for having me today. I was really looking forward to having this conversation because Prescription Advantage, as you know, it's such an important program. And we try so hard to get the word out to as many people as possible. So I think that this is a great way to be able to do it.
Awesome.
Yeah. So if you want, I'll just jump right in.
Yeah, that would be great. We're looking forward to this information.
Yeah. All right. So Prescription Advantage is what we refer to as a state-sponsored pharmacy assistance program. And when I say state-sponsored, what that means is that this is a program that's funded through tax revenue through the state of Massachusetts. We don't receive any federal funding. And as far as who is eligible for this program, because it is a state-sponsored program, naturally our members must be residents of Massachusetts. And we have benefits for people who are age 65 and over, but also for people who are under age 65 with a disability. And I'm going to get into a little more detail on all of that. What I do want to mention is, though, that who is not eligible for Prescription Advantage would be folks who have Mass Health, Common Health, or a Medicare savings program. And the reason why we exclude members with those programs is members who have Mass Health or Common Health or a Medicare savings program, they are already receiving assistance to help lower their prescription drug costs. And in fact, their copays are lowered to at a level that is even lower than what Prescription Advantage would be able to offer them. So basically, they don't need Prescription Advantage; they're fine. They are already their drug coverage is already being supplemented. So I'm going to break this out sort of into like three different categories. The first two, I think most people are not aware that this is available. So for starting with people who are under age 65. So if it's it could be a younger adult under age 65, but they must be able to show us proof of disability. Okay, they must have a disability. They also need to meet specific income guidelines. And I've got my little cheat sheet here because whenever I talk about numbers, I want to make sure I'm saying the correct number. The income limit for a single person is $23,989. And the limit for a married couple is $32,411. Okay, so again, income if single, $23,989. Income if married, that would be $32,411. So that's where the income, you can't go beyond those income limits. However, because we're dealing with people under age 65, they may be married and they may have children living at home. So we have a question in our application that asks, other than your spouse, how many relatives live with you and depend on you for your support? So if say it were a married couple and there's 2 children, now that's a household of 4. That's going to increase that income limit. So I'd like to mention this because oftentimes people disqualify themselves. They say, oh, I'm over income, not realizing that having additional family members is going to make a difference. So all I could say is call Prescription Advantage and just tell them what your situation is, and they will be able to tell you exactly what the income limit would be. The people who are under age 65, as I mentioned, they need to be able to provide us with proof of disability. Now, that could be something as simple as a photocopy of an SSDI card. Okay, somebody who's receiving Social Security disability income. Okay, just show us that. Or there's oftentimes people this under age 65, but yet they've been disabled for more than 24 months. And in that case, they've become eligible for Medicare. Okay, all we would need to see is a copy of their Medicare card, because you wouldn't be under age 65 with Medicare if there wasn't a disability. So these are the things that we ask for. Then benefits that would be available would depend on whether or not somebody has Medicare yet, or if they don't. If they don't have Medicare yet, Prescription Advantage can offer primary prescription drug coverage. And this would be with copays as low as $7 for a 30-day supply of a generic drug, or $18 for a brand name drug. It depends on what the drug is, but it's still insurance that they can have free of charge. There is no charge for this coverage. They just need to apply.
Okay. And we do have a disability. We do have a disability office. We have Ralph DeChico, that I'm sure is probably very aware of this advantage, just in case, that residents could call if they're under 65 and are disabled, and we have the guidelines.
Perfect.
Kathy, tell me about if they're over 65.
Okay, now I'm going to divide that into two different categories, because we have benefits for people who are age over 65 who are not eligible for Medicare. Now, often I get the question, how can you not be eligible for Medicare? I thought once you turn 65, everybody gets Medicare. That's not necessarily the case. People qualify for Medicare based on their work history and based on how many years they've contributed to Social Security. So, you've often heard that term, you have to have 40 quarters.
Yes.
And we always say, well, what does that mean, 40 quarters? Well, 40 quarters is when you take a quarter of the year. So, January, February, March, that's one quarter. And, then April, May, June, that's another quarter. Okay. So 40 quarters actually is equivalent to 10 years.
Right.
Which I don't know why they don't just say that. It would be so much easier. But anyway, and we see this all the time. We have people who move to this country later in life. It could be because their children may have come to the United States to go to college and decided not to go back to their homeland. And oftentimes then, their parents may end up following them here. So for whatever reason it might be. But if we have somebody who, has moved to the United States and they're in Massachusetts and they've only been here for a few years and they're over age 65, okay, whether, if they may be working, but they haven't worked long enough to be eligible for Medicare. In this case, we can provide those folks with prescription drug coverage, and again, free of charge. So if they're working, we would ask for documentation that shows what their income is, and then we would determine, we have different what we call membership categories, and they're based on income. So we have ranges of income, and then that would determine what a person's copays are. So it's sort of like on a sliding scale. And they may have a deductible, but in any event, this is an opportunity for somebody who is not eligible for Medicare to at least be able to get prescription drug coverage.
Okay.
And then, when we talk about over 65, the folks that we seem to serve the most, it's really the vast majority of our membership are those people who do have Medicare. And in that case, when somebody is over 65 and eligible for Medicare, Prescription Advantage is going to become a secondary payer. And that means that their primary payer must be either a Medicare Part D plan. It could be a Medicare Advantage plan, those HMOs like Tufts and Blue Cross and Fallon. Okay, those are programs that include the prescription drug coverage. They may have that. Or in some cases, somebody may have what we refer to as creditable coverage. And creditable coverage, it's not a Medicare plan, but it's coverage that somebody may have as like a retiree benefit. They worked someplace, it could be through a union, and as a retirement benefit, they were given a package that included medical coverage, prescription drug coverage. That's fine. If they have something in place, then we will be a secondary payer. But again, that we tend to see those people who have a Medicare or a Medicare Advantage plan the most. That seems to be the majority of our membership. And this is where, Prescription Advantage can really help because, again, the things I hear all the time, it's like, well, if I have a Medicare drug plan, why do I need Prescription Advantage? Okay. Prescription Advantage, it's not going to replace what you have. So if you have a Medicare prescription drug plan, you keep it. That's your insurance. Okay. Prescription Advantage is going to be sort of that backup or a supplement to that. And I think that where Prescription Advantage really helps people the most is if they would ever reach that coverage gap that you've probably heard referred to as the donut hole.
Okay.
Yeah, everybody's heard of that. And the donut hole is a gap in the Medicare prescription drug coverage. And, in Massachusetts, we have probably about 24 different Medicare prescription drug plans to choose from. And the one thing that is in common with all of them is that they all have this gap, this donut hole. So, I want to just step back a minute to explain how people reach the donut hole, because I think it's one of those things that, people know it's not a place where you want to be.
Okay.
But oftentimes people don't really understand how is it that, you even get to that point. So every year, Medicare starts a new year on January 1st. So whatever happened in 2019, it's like this, we wipe the slate clean. We start a new year on January 1st. So from the very first prescription that a person has filled, maybe they go to the pharmacy in January, they get their prescription filled, they pay their copay. But what's happening behind the scenes is that their plan, whatever drug plan they have, their plan is keeping track of both what their member paid out of pocket, their copay, but they're also keeping track of what they paid. So really what they're keeping track of is the total retail cost of the medication. So if it were a $50 medication and the person paid, the person paid $10 copay, well, they paid 10, the insurance paid 40, so that makes it a total $50 charge. And every time they get that prescription filled, that total retail cost is being accumulated. Okay, and I think that that's what people don't realize because they're very focused on what they spent out of their pocket. And I've had people say to me, oh, I would never reach the coverage gap because I only have 1 or 2 prescriptions. And that's when I ask, well, what are they? Because we know there's some prescriptions that are very, very expensive. So as that money is accumulating, once it reaches $4,020, that's the point where the person has now hit the donut hole. They've now reached it. And we think $4,020, that's a lot of money. But think of inhalers. Now, I've seen the retail cost of an inhaler range anywhere from $400 to $1,200. Insulin is outrageously expensive. Prescription eye drops. So we're talking about prescriptions that the total retail cost is hundreds of dollars. And if you're having those prescriptions filled every month, that total cost is adding up. So it doesn't take much in a lot of cases to reach that $4,020.
Absolutely. I mean, I know that some cancer drugs are almost 10,000. Some cancer.
Yes, exactly.
So yeah, I am in shock that once it reached 4,020, that figure just staggered me because that's a very low figure.
You know what? In the scheme of things, it really is. And that amount every year with Medicare Part D, that amount gets a little higher. Mm-hmm. And, like next year, maybe it won't be, it probably won't be 4,020. Maybe it will be, 4,050. I don't know. We don't know next year yet. And, they push it out, but people still reach it because the cost of the drugs keep going up.
Absolutely. Drug companies.
Yeah. We never, it never seems to get ahead of it.
Right.
So what happens when you reach that, when you reach that amount? That's when people are now responsible for 25% of the cost of the medication. So just as an example, if we had somebody that had an inhaler, and I'll just go on the low end, let's say it's a $400 inhaler, and maybe their copay was $50. Okay, that's pretty much the norm. But, it'd be $50 and they paid their $50. But then at the point when they reach that coverage gap, that donut hole, now they're responsible for 25% of that $400, which means they're now responsible that their copay just doubled. It went to $100. That can be staggering, and it can be worse if somebody had an $800 inhaler. So, or whatever their medications are, to now be responsible for 25% of that retail cost, it's unfortunately for many people, it's unaffordable. And what happens? They don't take it.
Right.
They cut things in half. They skip, they take every other pill, whatever. But this is where Prescription Advantage can help.
Okay.
Now, I'll give you an example, then we'll talk a little bit about what those income limits are. But with Prescription Advantage, if somebody, I should mention these. If somebody has an income, an individual, if their income does not exceed $38,280. Okay, if it's a married couple and their income does not exceed $51,720. And I'm going to repeat those because they're actually pretty generous income guidelines. So again, single person income does not exceed $38,280, or a married couple, income does not exceed $51,720. If at those income levels, we would be able to provide coverage in the donut hole. So if somebody reaches the donut hole, Prescription Advantage is going to be able to help. So let's go back to my inhaler.
Okay.
So if we have someone that had that $400 inhaler, they're now faced with a copay of $100. The pharmacy is going to bill that $100 directly to Prescription Advantage. This is a nice feature of this program, is that there's no claim forms involved. You don't have to pay up front and then send us the receipts. All you have to do is make sure that your pharmacy knows that you have Prescription Advantage. We issue our members an ID card. That ID card has all of the information that the pharmacy needs to be able to bill us. And once they have you in their system, this all happens automatically. They bill your primary insurance first, then they bill Prescription Advantage. So we know the day that our members hit the donut hole, and we know, okay, now it's our turn, to jump in. So that $100 copay is going to be billed to Prescription Advantage. And depending on what membership category our member is in, they will pay either $18 or $30.
Oh, that's good.
So can you imagine somebody, you're faced with a $100 copay, but immediately you just saved $82 or you've saved $70.
Absolutely. It would, the mere fact that, someone, our seniors, they can't afford it.
Of course not.
They can't afford the 100. And the thought that they can take their medication because they can't afford it.
And, and that's just one prescription. And as we know, who takes one prescription? So once whatever prescription it is that got you to that coverage gap, every other prescription that you are getting filled,
right,
you're going to be responsible for that 25%. And that's going to be through the end of the year.
Okay.
And Prescription Advantage is going to be able to assist through the end of that year.
So the two questions that I have, and you're probably going to answer this, is how would they sign up for that? Number one. And then what if they were over those income limits?
Okay. We do have benefits for people over those limits. Okay. So the ones that I mentioned that I said would provide coverage in the donut hole, again, individual, $38,280, married couple, $51,720. And again, like when I mentioned before about that question that asked, are there other family members that live with you? Okay. This is not uncommon these days. Again, that people, they may be over 65, they may be over 75, but they could have children living at home, or it could be grandparents raising grandchildren.
Absolutely.
It's a very common scenario right now. And so, again, call Prescription Advantage to find out. But if income is over those limits, okay, we do have a category that does top off for a single person at $63,800, or for a married couple, $86,200. Okay, so this goes from where we left off with the limits for people for the donut hole coverage.
Right.
I don't have any other way to. That's what I call it, the donut hole coverage. So now we have this other range. People at a higher income level, they don't qualify for that donut hole coverage. And this actually is the only time that people do pay for Prescription Advantage. We charge a $200 annual enrollment fee. And then benefits don't start until that individual paid out of pocket $3,745. And that has to be spent while they're a Prescription Advantage member.
Okay.
So if somebody were to be joining Prescription Advantage today, or whatever point in the year, they would have to think, okay, it's going to cost me $200. Am I going to get any benefits from this? But you'd be surprised, or maybe you wouldn't be, because you mentioned the $10,000 cancer drug. Okay. Can you imagine what the copay is on that? Usually, when you have a medication that is that expensive, people don't pay a flat copay. They usually pay a coinsurance, which is a percentage of the cost of the drug.
Right.
So even though when we say somebody has to spend $3,745 out of pocket, there are some people that can do that in January. And I know that because we have started paying claims on people in January. So the nice thing about that level is the fact that it's putting a cap on what somebody is going to spend out of pocket. And somebody who spends that, one of our members in that category, they're not going to pay anything else for the remainder of the year. So
and that's why I asked if they fall into that category. And I'm just in my head, a single man, a single woman that makes up to $63,800. I don't think that's out of the question.
No,
$200 to pay annually, and $3,000. So like I said, when you pay $10,000 a month for a cancer drug, and it could be diabetes, or it could be any number of diseases.
That's right.
Any number. To me, that's absolutely worth it. And to not know that you have this benefit, to not be aware, and to be paying, or to maybe refuse it because you're not being able to afford it. So, I mean, this is great information.
Yeah, Debbie, I agree. It's a lot of people just aren't aware of this program. And again, we need to make sure more people learn about it, because we have room in our membership. We can take on a lot more members. And you did ask, how do you apply for it? Okay, there's a couple of different ways. First, you can call Prescription Advantage, and I'm going to, that phone number is toll free. It's 1-800-243-4636. Let me repeat that. Okay, again, 1-800-243-4636. But don't think you dialed the wrong number. When you hear the phone answered, I think it might say, "Welcome to Mass Options." Okay, Mass Options is sort of that umbrella that all of these programs fall under. So, there is one of those prompts that says, press 1 for this, press 2 for that. Okay, Prescription Advantage, we're press 3. You don't have to go that far into it. So, so when you reach Prescription Advantage, you can ask to have an application sent out to you. Or our customer service rep will also offer to do it over the phone. So if you have the time, it's not going to take that long. They're able to have you on the phone, get all of the information. They'll do it, right then and there. Another way is we have an online application through our website. And our website is www.prescriptionadvantagema.org. Okay, so again, www.prescriptionadvantagema.org. So if you're comfortable, for our computer savvy folks that say, oh, I can do this myself.
Right.
Great. Go online and enter it. And also on our website are the forms. So you can print off an application form from our website as well. The only thing that is in addition to this is the fact that we are going to ask for proof of income because we are a program that does have income limits. We will ask for proof of income, which if you still file federal income taxes, we would need a copy of the most recently filed form. And also, if you have Social Security benefits, we would need either a copy of the 1099 from Social Security or a copy of the annual award letter. But, if you're talking with somebody at Prescription Advantage, they'll go over all of this with you. And that information is also out on the website in terms of what we need for that proof of income. But Prescription Advantage, it is a program that you can apply for at any time. We don't have one of those little window, open enrollment periods. The whole year is an open enrollment period. And just one added benefit I want to mention, and this is just another reason to join Prescription Advantage. And if you said, well, I don't have any problems, I never reached the donut hole, but as a Prescription Advantage member, you are entitled to a Medicare special enrollment period. And this special enrollment period is one time a year. And this is every year. You have this added benefit where if you wanted to change your Medicare plan outside of Medicare's open enrollment period, you can do that. You can do that once a year. And Debbie, you have your Shine counselor, who, Barry is very familiar with the special enrollment period because she uses it all the time. What happens is Medicare has their annual open enrollment every year, and open enrollment is from October 15th to December 7th. This is the time of year that we strongly encourage people to check their drug plan, compare it, look to see what's available for the following year, because every year plans make changes. And people don't understand how important this is. And they say, well, my plan works great for me. I've had this plan for a couple of years. It's fine. Everything's covered. My copays aren't that much. And then, so they don't make a change. And then the following January, February, they get their first premium bill. They find that went up. Or they go to the pharmacy. They realize their copays went up. Or even worse, they may find out that one of their medications is no longer covered.
Right. And that is huge, what you just said.
It is.
When you find out that drug that you need, that you've had, is not covered, and you all of a sudden are paying this huge...
Exactly. So this is where, Prescription Advantage can really, can help. And I know that your Shine counselor, Barry, gets the phone calls and says, what do I do? My plan isn't working anymore. And the first thing she'll ask them is, do you have Prescription Advantage? Because if you don't, we're going to get you on it. And that way you get on Prescription Advantage and now you can make that change. So it's a very valuable program in so many ways. We can save somebody money even by not paying claims. We just help them because we're able to get them into a better plan. So it's something that it's just another reason to think about. It's added insurance.
Absolutely. Yeah. Is there any other information that you think we should add regarding Prescription Advantage? If you wanted to add one more.
Just to tell you that part of our application process we are looking at income. And you know what I didn't mention, so I'm glad you brought up this opportunity to add something else, is that the fact that we don't look at assets. And that is highly unusual when you're dealing with any state or federally funded program. They usually look at both income and assets. Prescription Advantage does not count assets to determine eligibility. But through our application process, we're actually screening people to see if there are other programs that they may qualify for. And there is another program that's called Extra Help. And Extra Help is yet a program that helps save on prescription drug costs by helping to pay the prescription drug premium, the plan premium, and also lower copays. So if we see that somebody may qualify for Extra Help, we will offer to do that application right over the phone with them. We get on the phone, we call the applicant, we say, okay, we received your application, but you may also qualify for this other program in addition. So yes, we'll continue to process your application, but we also want you to know that you can save even further on your costs. So just another reason to reach out to Prescription Advantage, and of course, reach out to your Shine counselor, because your Shine counselor has all of this information. And, he or she, depending what town you're in, they're able to help you. And you can reach Shine by that same phone number. So if you don't go directly through your local senior center to access your Shine counselor, if you're not really sure, it's that 1-800-243-4636. You can reach the Shine program through that number as well.
Kathy, I want to thank you so much, because I think you have given us some great information, great examples that our seniors can use. I don't see any reason why any senior listening to you today would not call Prescription Advantage. If you fall into if you meet the qualifications, there is
the income. We have the income limits.
Yes, no reason.
Right.
From the information I've read, I see the average cost of prescriptions for seniors, and just an average, is over $5,000 a year.
That's right.
And from hearing that information and then seeing what Medicare, that limit totally throws me off. So that donut hole, that seems that gap. Why would you not call?
Right.
I'll reiterate for Kathy again, the number is 1-800-243-4636. And again, if you're online, www.prescriptionadvantagema.org.
You got it.
Right. Again, I see no reason not to call either that 800 number, call the senior center. We can get you in touch with Barry. Again, thank you, Kathy. Thank you so much.
Yeah, thank you for having me. I really am so happy to have this opportunity, and I hope our phones start ringing off the hook.
I hope they do too, because it's really a benefit for our seniors. Sometimes if you don't have this information, or if you just missed it once and you went, wow, this is great. So we will continue to play this on our Revere TV. It will be on YouTube. So hopefully we can spread it outside of Revere as well. And to my seniors, I hope this has been great information for you. Remember, be happy, be healthy. Thank you.
Okay, thank you.